Hi, this is Steve Rowe, Executive Director. Today is Wednesday, July 28th. It was a board meeting day for me, which always starts a little bit earlier than normal. The meeting was at 7 a.m. and this was the first live meeting that we've done since February of 2020, so 17 months ago. And because it was the first live meeting and it's like we had some new board members who didn't know where they were going, the day started even a little bit earlier. So it's already been a few hours into my workday. It was great to get people back in the building, and we also did need to do this meeting as a video conference as well because of potential COVID exposure from two of our board members. So the COVID activity still is out there. We had said a couple of weeks ago that we were not going to talk about COVID updates for a while unless the situation changed, but I know it's very much on your minds with the Delta variant and seemingly increased case counts and the more rapid transmission from the Delta variant. The data that we have been using currently is only being updated on a weekly basis now instead of on a daily basis. But the last time that I updated it was just late last week. And case counts, the 14-day daily average case count had increased to just over 5 new cases per day, which is trending in the wrong direction, but it's not a huge number, certainly not in comparison to where we had been. Positivity rate is also trending in the wrong direction at 3.1%. Again, the data is only being updated on a weekly basis now, so we don't know what our current situation is, but it's certainly going in the wrong direction right now, and we expect it to continue to increase for the foreseeable future. Because of that, we do want to give you a couple of reminders, and some of you may have noticed that there was new CDC guidance that came out yesterday. The guidance wasn't especially clear, but it said something to the effect of if you are vaccinated, they are recommending masks again if you're in public spaces that have high transmission rates. The obvious challenge is we don't know if we're in a space that has a high transmission rate when we're only getting data on a weekly basis. But the safest thing to do for you is while you're out and about in the broader Iowa City community to just put your mask back on. So if you're going to the grocery store, it's like our recommendation would be to put a mask on, and then it's like, no, when you get home again, you can take that mask off. Here within the Oak Knoll community, we know that 100% of our residents are vaccinated. We know that 98.6% of our employees are vaccinated, and the very small minority of residents or of employees who are not vaccinated are required to wear a mask. So it should be pretty obvious if you were interacting with any of the unvaccinated employees. So while you're here mingling with your friends in the restaurants, as long as you're not in either the health center or assisted living, you do not need to wear a mask. We will let you know if that changes, but for now, that is our current stance. And just a reminder that if you visit friends in either assisted living or in the health center, the rules are different. We do have to wear masks when we're in common areas in assisted living. Once you get to the resident's apartment, if they are comfortable with you not wearing a mask, you can take it off in the apartment. But in the common areas of assisted living, we have to wear masks. And also in the health center, you have to wear masks really all the time unless you're in somebody's room and the door is closed. So just be aware of that. There's also been some confusion about screening. Do residents need to screen? If you're in the independent living parts of our building, no, you do not need to screen. If you go to visit friends in either assisted living or the health center, yes, you do need to screen. So you can use one of the screening kiosks that we as employees use on a daily basis. It will take your temperature and print out a nice little name badge for you. And that is sufficient to allow you to go to see your friends in assisted living or the health center. So enough about COVID. Last night was the second of the summer concerts, and I walked through about 5:45 yesterday afternoon on my way out of the building, and it looked like there was a great audience, people enjoying the music, people enjoying the food and each other's company, and it's like that was the second of the events, and I think there are 8 planned through the rest of this summer, so and leading up into even late September, early October, I think, is the last of the concerts. So continue to enjoy that as we have those opportunities. Tomorrow evening is the resident semi-annual remembrance program. And then immediately following that remembrance program, there will be a business meeting of the resident council. And then the program portion of that business meeting will be an introduction of our board members to the residents who live here. So I have asked all of our board members, anybody who's able to participate, to come in and do a quick introduction of themselves and share a little bit about their background and experience so that you have some sense of who the governing bodies are for Oak Knoll. One thing's like, it was really easy, or it is easy for me to just kind of get back into normal operations. And it's like, oh, we've got a concert and we've got a program. One of the things that we vowed to ourselves is we would be more thankful for the opportunities that we missed for the last year. So I'm trying to remember that it's like, no, being able to gather in person when it was missing from our lives for so long, just really to be thankful for that opportunity. So I really enjoyed seeing everybody at the concert last night, having a good time, and we just need to remember to be thankful for those things. In the spirit of thanks, I also want to give a shout out to James Mims. James is leaving us on Friday this week to pursue his passion with Neighborhood Centers of Johnson County. And James has contributed greatly to the Oak Knoll community over the last 3 years, and he will definitely be missed. So thank you, James. And that's really all I have today. I'll be with you again in a couple of weeks. Take care.